Dissociative identity disorder. Dissociative identity disorder is referred to as a multiple personality disorder, a condition wherein a person's identity is fragmented into two or more distinct personality states. People with this rare condition are often victims of severe abuse. The cause is thought to be a complex psychological condition that is likely caused by many factors, including severe trauma during early childhood, usually extreme, repetitive, physical, sexual, or emotional abuse. DID was one of the earliest studied psychological disorders. The first serious study of DID was undertaken by the Frenchman Pierre Janet in 1883. The diagnostic criteria for dissociative identity disorder is two or more distinct identities or personality states, each with its own persistent pattern of perceiving, relating to, and thinking about him or herself and the world. Sometimes people confuse three mental disorders, only one of which could be referred to as common within the population: bipolar disorder, manic depression, and schizophrenia. People with schizophrenia do not have split personalities. Rather, they are split off from reality. The question that many ask is, how many personalities can a person have? The American Psychiatric Association states that an individual displaying at least two personalities, in which these take control of the patient's behavior, can be diagnosed with dissociative identity disorder. People with DID believe that a memory loss occurs when the patient's consciousness is usually shy, introverted, and insecure, whereas some personalities may be flirtatious, outgoing, and yet others may have issues surrounding anger management. Personalities may be older than the age of the patient, younger, or may have lived over 100 years ago. There is no limit to how many personalities a person can have. There are many examples of DID, one of them being the famous novel Dr. Jekyll and Mr. Hyde. Many people use the terms Jekyll and Hyde to describe individuals who display a two-sided personality, one side of which is good and the other side which is evil. Patients are skilled at hiding their multiple personalities from family and friends. A person might be Sam, a shy clerk at work. However, at night he might lead a life, an outgoing man who spends time in bars far from his neighborhood. Another famous example is the book Sybil, a book written in 1973. It describes the case of Shirley Ardell Mason, who was given the name Sybil Dorset to protect her identity. Mason sought out therapy for social anxiety and loss of memory, but her psychotherapist discovered that she had 16 distinct personalities. Sybil's personalities varied in gender, age, and in demeanor. Some had talents that others did not have, and some were able to function much better than others. Here is another video clip example.
Chrissy, I don't want you doing the strawberries.
I can wash them though, right?
And Papa, he has to have his coffee.
That's my mom does.
And Chrissy wants to have her juice.
I want to know where the pink donuts are.
Breakfast time is a busy time at the Patillo home. The only place busier than the kitchen is Christine Patillo's mind.
I'm just extra special.
Tristan, you are extra special.
I love you. I love you. But I love me.
What do we have going?
Cindy was just out.
Christine has 6 other personalities called alters
Am I Aunt Annie?
living inside her head.
You don't like blueberries in your pancakes either, do you?
I don't actually mind them. She despises fruit.
All distinct and different, all with their own voice.
I can hear them if I'm paying attention. They can look out through my eyes and they can see what's ever in my peripheral.
Dada, one more.
Sure.
Try it out.
That is 2-year-old Cindy. The rest of the gang, as they're called, will introduce themselves.
I'm Christine.
I'm Chrissy. I'm Tristan, the lone male.
I'm she. I am Q. I do all the beads. I'm Rim.
Christine has dissociative identity disorder, formerly known as multiple personality disorder. It's recognized by the American Psychiatric Association and affects just a fraction of 1% of the population.
I, of course, always get to play.
Who's my wife gonna partner up with?
I'll be the shuffler.
Doctors say Christine's brain got shuffled, fractured is the clinical term, when she was a little girl.
I just seem to be going the wrong direction all the time.
And that's different from when?
Funny.
Oh, that's what I'm going to do. Here, shebang.
That didn't work out well for me at all.
Christine suffered physical and emotional abuse from her father throughout her childhood and what can be politely described as torturous sexual abuse at the hands of a neighbor from the ages of 7 to 9. Her childhood, a cruel game of survival.
That was complete being imprisoned in my mind.
Drawings Christine did in therapy show the violent battles inside her head. Doctors say when the brain can't handle any more abuse, it fractures into different personalities, and each one often serves a purpose. Instead of Christine suffering the sexual abuse, Rim, a tough tomboy, would appear and absorb the shame. The alter She, a gruff 30-year-old lesbian, would come out and take on the abuse from Christine's father.
In conclusion, there is no for sure cure for dissociative identity disorder. Medication is not generally effective for this disorder. Maintenance and effective use of prescriptions given the multiple personality states is difficult to attain. If medication is prescribed for a psychiatric condition that co-occurs with an identity disorder, it should be carefully monitored. Psychotherapy is a treatment of choice for individuals suffering from any type of dissociative disorder. Approaches vary widely, but generally take an individual modality and emphasize the integration of the various personality states into one cohesive whole personality. The new term for this disorder in the DSM-IV more accurately reflects the problem the individual suffers from dissociative identities, which have been split off at some point in their past. Hypnosis has been reported as a mild form of treatment. Despite this, the use of hypnosis with patients has been and remains controversial. Over the years, many prominent individuals have stated or implied that hypnosis can create multiple personalities. Several other figures echo these cautions, and some investigators have used hypnosis to produce phenomena which has been described as multiple personality. Self-help is a growing trend that people with disorders are starting to come together to form mutual self-help support groups within larger communities and virtually through online communities. There is no overt reason why a support group for this disorder would not be beneficial to individuals.